Dr. Ben Newman, and I study coronaviruses. Let's talk. Okay, next question today is from Diane. Good morning. Yeah. Let's see. If antibodies in COVID 19 patients wane after a few months, which, yeah, almost all the studies have shown this. There was one in Iceland where they didn't drop off particularly quickly, but all the other ones have shown it, and we have seen people get reinfected now. And so I think this is going to be a thing that happens very commonly, but maybe not in every single person. Yeah. But at the same time, you're not going to know, are you? Yeah. Yeah. So let's see. Suggesting you could get the virus a second time, why wouldn't the vaccine have the same issues? It totally would. Not going to have the same issues for everybody, but definitely going to have the same issues for a lot of people, you would imagine, just based on, generally there's going to be, so I haven't seen a paper yet where you get a stronger immune response from the vaccine than you would have got from just getting the virus. At best, they can say that they're roughly comparable to usually a mild to moderate infection. From the papers that I've looked at on the ones that have gone through phase 1 and 2 clinical trials. There's still a couple that have yet to publish their phase 1 and 2 data, so for those, we'll find out when they care to show the rest of the class what they're up to. Yeah. So please explain how a vaccine would work for long-term protection. It wouldn't. And would we need more than one? Probably not. The virus is still close enough to its original root that no. Flu virus has been around for at least thousands of years, and it has had a lot of time to spread out and become different strains, and that require different immune responses. This virus, SARS-CoV-2, is still just a little baby. So yeah, don't worry about the baby. He's gonna be fine. Yeah. Okay. Yeah. So what's this mean? This means that we're going to need a combination of masks and vaccines to dig our way out of this, which is, again, something that people aren't going to like at all. Yeah. But something that I feel like people have got used to in different times and different places, and people can get used to. I just feel like they need somebody, at the top, showing them that this is all right and this is the thing to do. And the trouble is, every country's got its own government, and they're all people, and people have their own ideas, and they tend sometimes to govern from their own ideas rather than looking at what might be best in the long term for a country, or what might do the most good for the most people. I mean, that's what you'd want, I would suppose, but I don't know that that's what you would always get. But again, that's a whole other matter. We can talk about mask safety here, but politics is beyond me. Yeah. But yeah, we're talking about needing multiple rounds of vaccination in a year. And the question is, I mean, in the U.S., it's taken us, I don't know how many months to do a census. If it's 9 or 10 months, something like that. And actually getting hold of everybody and getting the vaccine in their arm, and probably needing to do that at least once a year, but probably twice a year if you actually want to be safe. I don't know that there is any. I mean, the logistics don't exist at the moment to be able to do that. There aren't enough trained people who are willing and able, and don't have another job that they need to be doing to go out and do this. In order to move toward that, you would have to talk about a big reorganization. You would have to talk about mobilizing almost the military-sized units to go out and have this different purpose, which would be delivering vaccines, which is something that has been done in various ways at various times. And would have its own little set of problems, but that's the biggest sort of single unified force that would do what you told them. Yeah, that I can think of in most countries. Everything else will be a little smaller, or like the health service in other countries is already going to be engaged in being the health service in those countries. And COVID doesn't mean all those other things go away. It just means we're really focused on this, and all those other bad things are happening at the same time. Yeah, adding one more problem to the pile is I don't know. At some point, you're going to break the camel's back, but you hope you don't. Yeah, because that would be bad. So yeah, great question. Sorry, I don't have a better answer than that, but yeah, that's what it looks like right now. We have yet to see phase 3 results from any of the major U.S. or European vaccines, as far as I'm aware. So there's a chance, but from the phase 2 data, it does not look like a very strong chance that this would give long-term protection in most people or maybe in anybody. So that's where we are. Yeah, vaccine's going to help, but vaccine is not the answer that is going to stop this all by itself, unfortunately. But, help is help. We'll take it. Yeah. Thanks very much. This is Ask Dr. Ben.